Hi, Better Babes. Welcome back to Getting Better. Today, we are talking about something that I need to talk about. Depression, high-functioning depression, burnout, ADHD, mental health. What is going on with the state of mental health? Dr. Judith Joseph is a psychiatrist. She's an author, and she's an all-around mental health literal doctor badass who is going to teach us about the differences between ADHD, ADD, high-functioning depression, burnout, all the things. Dr. Joseph, how are you?
I'm great. It's so good to see you.
I love you to pieces. I also am obsessed with your name. I love alliterations. So you are a clinical psychiatrist, a scientist, and an educator who breaks down complex mental health topics in a way that's deeply human and hopeful. Honey, are you not the medicine that the world needs? So let's start here. The motto of your lab is understand the science of your happiness. What does that really mean?
Well, there's only one you. There will only ever be one you, right? There's only one me. But I find that many times we try to use what other people are using that makes them happy. And then we end up feeling like, well, that didn't work. What did I do wrong? We're deflated. We get depressed. We get discouraged. And what I tell my patients is that, why are you using someone else's science? First, understand the science of your happiness. How do you know what's going to make you happy if you don't even take the time to understand what's making you unhappy? So when you understand where you're losing your points of joy, then you can be strategic and intentional and put back those points in the right place.
What's the difference between happiness and joy, and why does that matter?
Well, I have a lab not far from here, and I also have a research So I have a research lab not far from here and a private practice. In the research practice, we study the science of happiness. So we add up all these points, and then that's how we determine whether or not someone's becoming happier. In the private practice, I see patients for therapy, medication management. In my private practice, people will come to me and they'll say, Dr. Judith, I just want to be happy. And then I'll ask, well, what is happiness for you? And they'll say, when I get the perfect partner, when I finally get that job, or I finally buy the apartment, pay off my debt. It's always these things in the future. But the science shows us that when we get those things, we are still not happy, right? We're delaying happiness for this event, this idea. So think happiness is an idea. Joy, on the other hand, is an experience. So in my lab, when we add up points of joy to determine if someone's becoming happier, they are things like, when you took a nap, did you feel refreshed? When you were lonely and you reached out to your loved one, did you feel heard? Did you feel seen? Did you feel connected? When you were hungry and you ate your food, was it yummy? Did you savor it? These are all the points of joy that actually add up to happiness. But there's a huge disconnect. In the real world, people are like, I'll be happy when X happens. In the research world, it's no, all of these daily points of joy, that's what true happiness is. But we get so busy that we leave these points on the table.
Is everyone's human brain just kind of go towards the scarcity or the threat versus the joy or the not threat? Is that just a human survival thing because of the whole the snake is going to kill you and the rabbit's not going to kill you, so we pay attention to the snake?
Absolutely. So a lot of times human beings will predict the most terrible outcome. They'll overpredict it. They'll prepare for that, right? And that is a survival technique. If we imagine that the worst possible thing that happens if we don't work is, let's say we end up on the street and we don't have any money and we're dependent on others, then it forces us to overwork, right? But that's likely never going to happen, right? For many of us, for most of us. But our brain defaults into that survivalist mindset, that scarcity trauma. I've experienced that personally. I grew up with very little. And when I get into my high functioning ways and I start working a lot, I have to sit still and be like, what's this fear about? And it turns out it's that same core fear that I'm going to run out. Logically, I know I'm not going to, but from a deeper level, I'm so worried of running out that I overwork. I think many people are like that.
You popularized the term, which I don't know how to say it, but I think I learned about it on the podcast. It's anhedonia, right?
Yes.
One of our guests told us about anhedonia, and I think that's how we learned about you. But
okay.
So what is this anhedonia?
Anhedonia literally means a lack of joy. It is a very common part of the human experience. It's an emotion many of us have felt, but we didn't have a name for it. And it's been in the literature and the science for over 200 years, but no one knows it. So when we feel meh, blah, and we just don't feel like things are lighting us up in the way that they used to. Think about it. Do you know anyone who's really stressed out who's also very joyful?
I have high highs and low lows of like very joyful, but also very stressed.
Right. But it's really hard to be joyful when you're stressed.
Oh yeah, not at the same time.
Yeah,
That's
almost
so
impossible,
true.
right?
Yeah, that's so true.
And did you know that one of the points that we add up in our research is stress? In our depression research, one of the questions is stress and tension. For a reason, because it's really, really hard to access joy when you're stressed. That's why it's so important to slow down, to practice these tools that calm your fight or flight. And the reason I say fight or flight is because many of us, we're just running. We think we're running towards happiness, but we're actually running from something in the past that we've never processed. So we can't sit still. When we sit still, we feel empty. When we're not working, we feel restless.
That's hitting home. I mean, I feel like this is kind of bringing me a little bit to like our Young Pueblo episode of like, it's like mindfulness and like the fight or flight. Like that's like a lot. So how do we realize when we're in fight or flight?
You have to listen to your body. A lot of my clients will hold so much of their stress in their shoulders. And so we sometimes start the session with, tell me about how you're feeling here. But if you're not a shoulder holder, if you're someone who carries it in your back, I'll ask them to really pay attention to their backs. Or I'll ask them, did you go through this whole day without going to the bathroom? And they'll be like, how did you know? Because you're not listening to your body. You're not treating yourself like a human being. You're a human doing. So that's one of the really important ways. Sometimes I actually look at my patients' hands. Some of my patients, they're so overwhelmed and overworked that they start to take it out on themselves. They start to pick. We'll look at patches of hair that are missing, inside the cheek chewed out. They don't even realize they're doing these repetitive behaviors to soothe because they've got so much built up angst. And the one that high functioning folks deal with is rather than, when you think of trauma, you think of PTSD, avoiding people, places, situations that trigger you. Well, high functioning workaholics, we avoid our pain by taking on more tasks. We know deep down we shouldn't, but we can't say no. Why? Because when we're still, we are restless. We feel empty. So we just keep doing. But over time, even if you're hitting those marks and you're getting all the accolades and people are like, wow, you're doing great, you're not enjoying it. You're feeling meh, blah. You've lost the joy. And that's when you know it's a problem. It's different if you're working hard and you're enjoying it and you're getting a sense of purpose. But when you start feeling that numb, that, I'm not even getting joy out of this anymore, but you can't slow down, that's when you have to start paying attention to it.
What does that mean if I'm like, not good at not doing anything and it doesn't necessarily feel comfortable? Does that mean that there's just something, well, I guess I already know, like there's definitely things that I haven't processed that have happened in the last few years that I'm just still really sad about?
Well, I'm not your doctor, but what you're saying sounds like, you've thought about it. You've thought about what happens in the past when you're not busy. You're afraid of it, right? And that's what I'm talking about. Many times we do things because we're afraid of something that we haven't processed, that there's that fear for you from what you're saying that like, if you slow down, then something bad will happen. So then you say, well, I'm not going to slow down. I'm going to keep doing. But what happens when people don't slow down is that their dog will come to them and will want to cuddle with them. And they're just like too busy or they're just too stressed. So they won't even, or when they do take vacation, finally, their mind is not present. They're still at work, right? And that's a difference between burnout. Burnout, by definition, is caused by the work. So technically, when you remove that person from the work, they should get better. High functioning folks, even if you take us out of work, we're still working. We're still busy.
So I got the high functioning depression then.
Well, I'm not your doctor.
No, but that's what it's giving. But that is really true for me. Like even when I do take the time away from work, I am always thinking about it.
Mm-hmm. Yeah, it's coming from within. The pressure from work is gone. The work is not there, but you can't settle down, right? Something inside of you is saying, don't slow down. Keep going. And what I found with my clients is that when you do that, when you're constantly on the go, over time, you don't even enjoy the work anymore. You just can't stop because of the fear of not working. And you're missing out on the simple pleasures, like, sitting with your loved ones and just not thinking about anything else but them and enjoying a real laugh, sitting with your pets.
Yes.
Playing with them.
That's why it's coming up for me so much right now. I have a 12-year-old cat and he's like my baby, my little hairy Larry. And just like a couple weeks ago, I was like really in the trenches on this work thing and he kept like walking around me, like wanting me to hold him. And he's having some like health things at the moment because he's 12 and 12-year-old cats start to have like chronic kidney things and it's just, so we've been at the vet a lot. And so I just had this moment where I was like, girl, like there's going to be a time in like 2 years where you're going to be so mad at yourself that you didn't stop and hold him.
Yes.
I'm like crying just thinking about it.
Yeah, that's what I'm talking about. I was the same way with my daughter. There were times when I would be working and I wouldn't be thinking about, well, she's not going to be 2 forever. It's things like that. On your deathbed, you're not going to be like, I wish I got one more show. You're going to be like, I wish I could be with my cat.
Well, I will say that I wish that Getting Curious had 2 seasons, probably on my deathbed. That will probably be one of the biggest hurts of my career. I will say that, but Larry would be bigger.
Yes, that's what I mean.
Yeah, Larry would be bigger. So that is the difference in between high functioning depression and burnout. High functioning depression, even if you take yourself out of work, you're still there. Burnout's like, that you have burnout if you like leave work for like a week and then you come back feeling really good.
Well, when you leave work, when you have burnout, you're like, whew, like, thank goodness. When people leave work and they have high function depression, there's let me do more work. Let me keep going. Let me take on this side hustle. Let me take on this person's problems. I can't sit still.
In your new book, High Functioning, it digs into a massive cultural blind spot, people who appear to be thriving, but are actually struggling deeply. And we were just talking about this a little bit, so we've established a little bit of the difference between high functioning depression and burnout. But I remember the first time I heard about depression, it was like in the mid 90s. I was like 8. And I remember back then, like the word was like, there was like clinical depression.
Yes.
There was like bipolar. There was certain, but how do we think about depression as like a whole now? Like culturally, like what are any of the differences? Is it like, how does it work? How do we think about it?
Well, most people still think of depression as being sad or crying, not getting out of bed, not getting things done. But I like to describe depression as being like 2 sisters. One sister cries and is not getting out of bed and gets all the attention because she looks depressed. The other sister is not crying. She has anhedonia. She doesn't feel anything, but she doesn't get attention because she's not in crisis. And I think most people don't know this. You don't have to be sad to meet criteria for depression. You can just have anhedonia and have all the other symptoms like changes in your sleep, changes in your appetite, movement, and so forth, and then meet criteria for depression. And so that's why I think when I started talking about anhedonia, people were just like reaching out, DMing, like, I need to know more about this. I don't think most people know that. They don't know what anhedonia is, and many people experience it.
And that's just like, if like in a year, like figure skating and gymnastics, I just didn't care about it.
Yes.
Like it's like when I just like stopped watching it and I was like, I don't care. Actually, one of my worst drug relapses I ever had, it happened during like the 2014 Sochi women's like figure skating final. And I remember when I was like crashing off drugs and then I realized that I'd like missed the figure skating final. I was like, ooh, this isn't good. Like you relapsed instead of watching figure skating. Like I know I'm fucked up if I didn't want to watch figure skating. Yeah. Like, so.
Anhedonia is really prominent in substance use. And the thinking is that, a lot of people who have chemical dependency, people think, oh, you're just doing it to get high and have fun. No, it's the opposite. When you become dependent, you're no longer getting pleasure from using. What happens is that you're so afraid of the physiological withdrawal that you use. So you're not getting any joy from it. A lot of people who are recovering from chemical dependency will say that they have anhedonia. And so they have to really try to rewire their brain to be able to access joy again.
Oh, that's so hard. That resonates. I know what that's like. You use the phrase pathologically productive. That makes me feel personally red for filth. Because people praise it.
Yes, they do.
And it's something that I like, while on one hand, I'm really grateful that I do get to mostly do things that I am really passionate about. I am afraid of not doing things. It's just, I almost feel like these last 8 years, I'm like, well, at any moment, like this career and like all these opportunities could be over. So I have to say, it's like, it's not healthy. It's like not sustainable. I know it's not. But how does that show up in everybody's lives? I know I'm not the only one.
You're not the only one. A lot of us, we don't feel like we can show how we feel because others depend on us. When you're a leader and you're a business owner, you don't want to let down the people whose paychecks depend on your work. And so not to say that people are inherently bad because they're taking, but when you set up your life in a way that so many people depend on you, then you feel guilty for slowing down. When someone says to you, you should take a break, you interpret that with this all or nothing thinking, well, I can't stop. Others depend on me. No one said you had to stop, slowing down doesn't mean stopping. It means taking care of yourself. It means getting a good night rest. It means actually eating healthy foods, drinking water, you know? But we get into this all or nothing thinking where we feel like we have to keep going. We have to keep going. And then something eventually is going to give. Our bodies break down, or our mental health breaks down, or we start using substances or drinking heavily, or coping in ways by overspending, gambling, things like that to soothe. So it's important to acknowledge that, you know, when you're productive, it becomes pathological when you're no longer accessing joy. And that should be a red flag that you have to start doing something differently.
You also talk about something called scarcity trauma in the book and how it feeds these patterns of overwork and numbness. Can you unpack what scarcity trauma is and how it shapes our adult behavior?
Yeah. So when you think about scarcity, most people think, okay, maybe I went through something where I didn't have resources, but it doesn't need to necessarily be yourself. And so there's individual scarcity and there's generational scarcity. If your parents or your grandparents came from like war or they were impoverished, they sometimes pass some of those behaviors on to you based out of a fear of losing resources. So you may overwork because you're afraid of running out of money, or you may hoard things unnecessarily. And it's not considered a bad thing if you're like recycling, but if you're hoarding things that are trash, like if you look under your sink and there's like so many bags you can barely find anything, or you know, take pens from hotels and you got these drawers full of these pens that you'll never use and it's creating so much clutter. Or you have things that you bought, but you'll never wear them because you just feel guilty wearing the new things, but you hoard all the things with the holes. You know, that's a problem. So many of us, we have these behaviors rooted in past scarcity that we don't even understand. Another thing is the opposite of hoarding and collecting resources. It's spending, you know, and not being familiar with abundance. So what do? You spend, or you live on the edge where it's like any minute now you could run out of money because that's what you're more familiar with. Abundance is not familiar for you.
That's resonating, but I buy abundantly, but I'm probably going to end up living in my purses like houseless.
I hear that all the time. And so I think that your experience is what people don't even connect to scarcity. They think like, well, why would you spend so much if you've come from scarcity? It's like counterintuitive. No. If you're accustomed to not having, then, you know, having feels unfamiliar. So you end up spending in ways that put you right back to your baseline.
So why is joy so important in dealing with the things that make us sad and dealing with mental health?
There's so much that is out of our control. There's just so much going on in the world. And when you look throughout history, many times groups who are, you know, really marginalized access joy as a survival technique. You know, there was the theme of the Met was the Black
dandyism,
dandy,
yes.
Right? When you think of the Black dandy was a slave who was property, was an enslaved person from the African diaspora who was property, who was adorned to parade around to display their, you know, the person who owned them, their wealth, right? But look at what the Black dandy has transformed into. You know, after slavery ended, that culture of, look, I'm human. I have refined taste. I am it's possible for me to rise above, you know, my former situation. And that just continued to evolve into Black communities developing their own sense of style, music, art. Had it not been for that joy, there would have been no survival. There would have been no resistance. So no matter what's happening, because the world is so chaotic these days, you have to be able to find joy in the chaos. And when you go to other countries, you'll see people who have nothing, but they're still laughing, they're still able to eat, they're still dancing sometimes. It doesn't mean their life is perfect and they have no problems. They're still able to access joy because we need it to survive. That's why it's built into our DNA as humans. It's our birthright.
And also, like, it's a little, if you watched our episode or listened to our episode with Gretchen Rubin, then this may be redundant for you, but it really is worth saying. Accessing joy and creating like pockets of joy is something that I've written about, talked about, and it's just been like something I've been naturally geared towards. I didn't even know that it was like that important. But as a public figure, something that's happened is like, I will take so much criticism for sharing that joy. Like, don't you know what's going on over here? Don't you know what's going on over there? You haven't spoken about this enough. You haven't spoken about that enough. And so when you do share joy, a lot of times it's not received or like not from, but then I overly notice the negative and not the positive. And so over the years, I've noticed myself be more reluctant to share my joy because I don't want it to be judged. And I want it to, my mental health like can't take it so much. And then I interviewed Gretchen Rubin a few times, who I look up to and adore. I think her work is so incredible. And she was saying like, joy and being happy is like what keeps you connected to the work. So you can help educate and deal with these things that are going on. If it's only like, people hurting, you're powerless.
Yes.
Like if we don't have joy to access, what's the point? And so that really is important. Like accessing joy is important work. Yes, it's joyful, but it's important work. And we shouldn't be like policing other people's joy, because it literally, if you have no access to joy, you're not engaged. And if we're not engaged, I mean, I think there's a reason why we had like under 50% voting in 2024. I mean, voter turnout was incredibly low. They were not happy. And not only were they not happy, they felt guilty and shamed for being so.
Yeah. Well, there are studies that show that people who are joyful are more likely to help others.
Exactly.
They're more likely
That's
to
what
go
Gretchen
out
was saying.
and they're more likely to go out and change the world, to create positive change.
Yes.
So when we're really bringing others down for having joy, we are doing the world a disservice.
Yes.
Yes, it's important to be, to honor that there's pain, but there's also an importance in honoring joy.
I just have to say, I love you so hard, like instantly. Your work, I mean, your work preceded you, TBH, but such a fan. You are just, your presence and your voice is like, I feel like I've learned so much and I just like want to spend more time with you.
Oh, thank you.
So many listener questions. When I asked about what are your questions about high functioning depression, burnout, ADHD, mental health, autism, OCD, all the things, we had so many questions. So actually like thousands. So I went through and I tried to identify the ones that I saw the most often. If we didn't ask your question here, I think I realized that this is like a large area where you want me to be in more often over here on Getting Better. So we will get to it. Okay, you ready?
Yeah.
ADHD, how does this show up differently in kids versus adults?
Well, children are way more hyperactive and impulsive. So in my office, sometimes I have a camera because sometimes the kids do run out. They're so busy that I have to have my eye on them at all times. And what you tend to see is it's almost as if they have an internal motor. So they can't sit still. Sometimes they'll like hop, they'll run, and blurt out things loudly. With adults, that hyperactivity over time gets toned down, and adults over time learn that they can't do that, right? So they start to mask it. And so what you'll see instead is like adults who continue to twirl their hair, or they have a pen, they'll be flickering the pen, or they'll be like shaking their leg like this, or constantly shifting. So that's the type of hyperactivity, the physical hyperactivity you see in children versus adults. The inattention with children, you'll see them sitting in class, and sometimes I have to go to the schools to observe them, and they'll be like zoning out. Whereas an adult has learned over time to mask that. So they'll just be in a meeting, they won't look away, but if you ask them to recap what you just asked, they'll be like, what, can you please repeat that?
Yes.
So they've gotten a lot more skills in terms of hiding their symptoms. The other thing is that with a child, you open their book bag or you go in their room, things are a mess. But with an adult, because many times, you can't necessarily do that if you're living with people, what you'll find is their purse is cluttered or their closet's cluttered. So they try to hide their mess. But the symptoms are still there. With a child, they'll blurt something out, verbally impulsive. With an adult, they have a hard time waiting in line. So they'll be, even in a line in traffic, so they may get in a lot of accidents or speeding red lights, getting tickets. So that impulsivity shows in different ways.
So because kids are more probably impulsive and hyperactive anyway, is there more misdiagnosis of ADHD in kids?
There's more misdiagnosis or missed diagnosis in girls. Because in medicine, people think it's boys that have ADHD. But we're learning that a lot of girls get missed diagnosis because the society tells us that a girl's supposed to be well-behaved and supposed to be quiet, and a boy can be wild. So girls don't get diagnosed as often as they should.
That was actually one of the next questions, which was how does ADHD show up differently in boys and girls or men and women?
Well, I mean, girls, society tells
and
you.
And also I just left out and no, they didn't ask, but non-binary and queer people. And one thing I think about this sidebar, and I know this is kind of rapid fiery, but I face trans misogyny even with a beard on my face and like being able to be male presenting, because I understand that that's male privilege, but I am genderqueer, and I will also go out in the street in a dress with my hair pulled back and my tits out. And also it's not even about the way that I dress. It's like my energy.
Yeah.
Like I have been in a lot of work situations with other gay men and straight men. The things that they can say and do and get away with are not what I can say and do and get away with. If I had that tone, if I had like that vibe, I would have been fired so fucking long ago. It would have made your head spin. And so I often sometimes think about it's like an energetic thing, because there are a lot of women who have more traditionally masculine energy and there's a lot of men who have more traditionally feminine energy. And I'm not talking about how that individual identifies, but I think culturally we receive like we conflate those things.
Yeah.
Like it's if you have a male energy or a female energy or just have a more masculine or more feminine, and you're not in that body, you're going to deal with like a trans misogyny, like both ways.
Yes.
Like a woman who has a more male energy is going to be dealing with shit.
Yes.
A man who has, it's different. But I just think that's like, even with diagnoses, the way that we like talk about like, oh, well, for women, it's this and for men, it's that. I just see a lot of ways that we think are more traditionally feminine, like, you know, women picking apart other women's bodies. You look on TikTok now, you will have men
Yes, they do.
policing bodies, being so catty. And so it's, but they're seen as like these like masculine, no, like there's an energetic like conflation I feel like going on. It was like kind of a tangent, but I don't know if that resonates for you.
But with children, you know, it's important because teachers will not bring up a girl to a parent. Like they'll say, oh, they're being kind of like airheady. And it's like, no, they have ADHD.
Yes.
Whereas if a boy does it, it's like, well, you got to get that child checked for ADHD. So then you have all these women that don't get the support and they think there's something wrong with them. And they find out, I've had ADHD all my life.
And it shows up in school,
yes,
relationships.
work, everywhere.
Yes.
So it's one of those areas. Yeah.
A lot of questions about perimenopause, menopause, hormones, and how that relates to ADHD. We got to do an episode on perimenopause and menopause a few months ago, really eye-opening. We learned in that episode that a lot of women are often misdiagnosed with perimenopause or menopause, but really it was they were diagnosed with ADHD or like even schizophrenia or bipolar, but really they had perimenopause and menopause. And once they got their hormones regulated, all their mental health things got better.
Well, people who initially have schizophrenia, you should be thinking about, you know, when you're going through perimenopause and menopause to get more support, because hormones can worsen your symptoms with schizophrenia, with bipolar disorder, with ADHD, with depression, anything that you've had before. But also what makes it even more confusing is that even if you don't have those primary conditions, symptoms of perimenopause and menopause can mimic those symptoms. So you may be going through mood swings, problems with sleeping, irritability, and you're like, why do I feel this way? And then you go to a doctor and you talk about it, and then they treat you as if you have depression, major depressive disorder, put you on a depression medicine, you don't get better because it's really due
hormones.
To the hormones.
Is that why like postpartum psychosis and postpartum depression is such a big deal? Because it's like hormonal. And so then like you probably don't even need antidepressants. It's like you need hormones.
Well, you know, with postpartum depression, what happens is that in the third trimester and then right after you give birth, progesterone drops and allopregnanolone, which is a neurohormone, experiences fluctuations in the brain. So like what happens is that there's a real hormonal issue at play. But some people do get better with antidepressants.
Oh.
And so, but others get better with, there's only like 2 FDA approved medications for postpartum depression. I worked on those studies in my lab, and it's like a neurohormone-like modulator that helps the brain feel a bit more back to baseline, specifically for postpartum women. So that's a different cause.
One of my like just very closest, best dear friends like had like a massive like schizophrenic like postpartum psychosis break that resulted in like ending like of lives and jail and just devastating. And it's something that I like carried and never talked about because it's like not my story to tell, but it's someone who I've loved just like my whole life, and watching what happened to her and the lack of support and the vilification and like monsterification of her and her story. And then ever since I went through what I went through in relation to what she went through, it's like opened my eyes to like how many women have this happen and the lack of support. And just when you think about like maternal care and just reproductive health care, whatever that means to you, it's so important. Like women do not, it's like pregnancy can be one of the most dangerous things that you can go through. And then we're forcing women to give birth and we are taking away the social safety net that was already paper thin, was already resulting in deaths and all sorts of terrible things. But now we're taking the little protection that we had and ripping it away.
Yeah. I mean, with my patients, I say every single pregnancy should be a medical event. You know how you go to the doctor and you fill out your past medical history?
Yeah.
You should list your pregnancies because pregnancies are major events in your medical history. It changes your body. Some people have horrific childbirths. Some people have terrible postpartum depression. Some people have psychosis like your friend. I'm so sorry that
and then
they
we
went
have
through
these
that.
ladies on TikTok that are like, I'm not going to the doctor for my pregnancy. I'm giving my baby raw honey and I'm eating like fucking sushi. Like I see this stuff on TikTok where it's like back when people did that, like like most moms were bleeding out and your kid died of fucking cholera by the time they were like 6 months, you fucking idiot. Like what is going on with these Maha people? Are we so stressed? Are you stressed about the people on the Instagram and TikTok? Are you so busy like studying mental health and stuff that like you don't have time to be on TikTok?
Sometimes people have to learn on their own. If you want to,
it's a full let them situation.
100%. As my friend Mel Robbins would say, let them.
It's a full let them situation. Okay. A lot of questions about how to show up for someone in your life who's been diagnosed with like, you name it, but in any of the things that we've talked about, and obviously they're all very different, but how can you show up for someone and show up for yourself when a loved one has been diagnosed with how should I say this? Like mental health, like
mental health condition.
Okay. Yeah. So how can someone show up for someone that they love and themselves if they've been diagnosed with a mental health condition?
First, take care of yourself. You know, like it's really difficult to see someone that you love when they're struggling. And also if they don't want to acknowledge it or they're not ready to get help, it's super difficult. And, you know, it's even difficult for us as therapists when we see our patients struggling. So even more difficult when it's someone who you personally love, who's in your life every day. So take care of yourself and make sure that you are seeking support, because without you, without you being strong, how can you really help them? That's number one. But the second is mirror the change that you want to see. You know, like if the person isn't talking a lot, if they're not being vulnerable, you may have to mirror that vulnerability. So you may have to show things or say things like, I just went through something, I'm going to share it with you. And you're showing them that nothing bad happens when they share, when you open up. The other thing that you can do is let them know that you're going to be there no matter what. They don't have to do anything. Many times, those of us who don't share a lot or are, isolating, we think we're burdening others, and let them know that they're not a burden, that you're going to be here. You don't have to do anything. You could just be on the couch with them, watching TV or just being in their space. They don't have to do anything. But you're going to be there. That can be very powerful, because many times people don't feel like they deserve the love.
So it's like if someone was diagnosed with something, you could say like, if you ever feel anything and you want to just hang, like I'm there. Like I'm there so quick.
Or I want to see you no matter what. Even if you're not doing anything, we don't have to do anything. And meet them where they are, like meet their basic needs. A lot of times people aren't eating properly. So you may have to come over with some food. They're not sleeping well. So you may have to come over with something to help them self-soothe. Meet their basic needs. You don't have to go and
fix the life.
Yeah. You don't have to go over there and like change everything, but help them with their basics.
A lot of questions about burnout. If you are like, okay, I definitely got the burnout. Like when I leave work, I feel so much better. And then I'm like, I don't want to go back. I'm so overwhelmed. Is there anything that people can do to manage that? Like short of quitting everything and moving to a lake for a year, if you can somehow do that?
Last year with the former President Biden's administration, I went to the White House and I taught a workplace mental health course. And the people who worked for then President Biden, they love their jobs, but the job is stressful. So we spent a lot of time validating that work is stressful. So let's make work as joyful as possible. So I had them bring in plants to their workstation and then put those transitional objects around, pictures of your family or pictures of things that give you meaning and purpose, setting up the workstation so that you're getting some soothing. So like if you have a hard chair, get a soft cushion.
Yes.
If you're someone who tends to run cold, get a space heater if it's allowed. If they allowed fragrances, I brought in fragrances from Harlan Candle Company for them to spray around the office. But if you can use an oil diffuser. If you have access to a window, try to get some sunlight, look at nature, take breaks away from your desk, use a standing desk to get that like good movement. Don't be on Zoom for all the time. Like don't show your face on Zoom. Again, you can't, looking at your face all the time is stressful. So all of these things in a workplace setting, using, getting the movement, getting all the things, eating your food away from your computer screen so you're actually tasting it. And then we practice mindfulness at the desk. All those things make the workplace more joyful. It doesn't change the stress, but we're aiming at increasing the points of joy. And these are all things you can do in your workstation.
So you said something earlier, and I think this is so important because all of the burnout questions, and again, there were like hundreds of like burnout specific ones, they all had something like, do I need to just quit everything and run away? It was all something kind of similar to that. And in I can't remember what episode it was last year, but we learned that like wanting to cut and run from everything is like a huge symptom or sign of burnout. And I think what the unifying question is like, do I have to quit doing everything if I'm feeling, and what I hear you saying is it's really about like, no, you don't have to quit everything. It's about increasing your points of joy. You may have to get on the No Express train, like Marie Forleo told us, but also it could be about just increasing points of joy, increasing pockets of joy, and that could help to alleviate the burnout.
Yes, because quitting can lead to more stress. If you quit and you don't have, what the experts recommend, having several months of savings in the bank so that you can at least look for a job, not in a flight or flight state. Because if you are searching for a job when you actually need the money, you're going to make a bad choice.
Yeah.
So if you don't have that cushion, quitting is not going to help you. You may end up even more depressed. So use what you have in your environment. And then make sure that you're seeking purpose outside of work. Many times people who are burnt out, they end up just going on their couch, watching TV, binge watching TV and then going to bed. But if you're not accessing joy outside of the work either, then that's a one-way ticket to depression, right? So you want to be able to find things that bring joy outside of work too, and then to invest in that.
So important. I naturally kind of do that. Oh my God. So a lot of questions about whether it's like an acute situation, like you're in a panic, which we talked about earlier, or like it's a state of overwhelm and you're just like freaking out. I feel like I have that when I'm trying to get out of the house and I'm late and I have like really bad time blindness with the ADHD where like I'm not trying to be late, but my brain like thinks like all these extra things. And then like, it's like, I can't physically not do it. Like, it's like, I have to get it done. It's like this insane, like, it's so frustrating when I get like that. And then other people were asking about like more of a generalized funk. Like, how do I but whether it's an acute situation that you need to snap out of or like a long-term one, any tools or tricks for like snapping out of like an unwanted mental state?
Well, the whole term snapping out, it kind of makes you feel as if there's something wrong if you can't snap out of it. So I think maybe a reframe, rather than snapping out and going from low to high, again, it's those points. When we add up whether or not someone's getting better or worse in the research, in the science of happiness, we're literally adding up these little points of joy. We're not hoping to get all the way to 100. We're hoping to get you a point here or there. And so a point here or there for someone who feels like they're in a rut looks like getting up and making your bed every day, right? Or it looks like getting up 10 minutes earlier in the day to get a fresh hit of sunlight.
Yes.
Because that does something to your inner circadian rhythm, That may look like going for a walk rather than taking the subway the whole way to work or wherever you live.
Or if you have like the other end, it could look like not going to like the 38th class in a row or like not like when you're in the other side of mania. Cause I know someone who's dealing with that right now where they're just like not like maybe the self-care is like saying like to do a little less, and that could increase your points of happiness.
Absolutely. It's really hard to be joyful when you're stressed, taking it one step at a time so that you take away these responsibilities that are not necessary, but you're just doing them because you don't know how else to cope.
What about a lot of questions here, the relationship to, is there a link between ADHD, addiction, and codependency?
ADHD definitely puts some people at risk for addiction. In fact, it's one of the things in child psychiatry that will say, not treating ADHD can lead to broken bones, a lot of, tickets, speeding tickets, and substance use. And having addiction may make you more prone to depression as well. These things tend to travel together. Folks with high functioning depression, sometimes they cope with their pain by overworking and substance use, right? It's the only place they feel like they can relax. They get home, they knock back like a couple of beers, and before they know it, they're passed out on the couch, So it's very common. But also with ADHD, having that masking, having to show up and overcompensate for sometimes feeling so disorganized and scattered may lead people to feel depleted and to experience depression as well.
So this is like slightly unfortunate in the way that our rental place goes, but we are rapidly running out of time, and I'm obsessed with you. And so I kind of need to do these like last 6 questions in like rapid fire, but they're kind of important.
Yes.
So they're not necessarily that rapid fire-y, but it'd be insane of me to like not bring it up when I have you.
Yeah.
But maybe we'll just have to have you back some other time for like a part 2.
Yeah.
But if you can,
I'll
please.
get through quickly.
Okay, so if you haven't heard your question asked yet, maybe it's coming. It's like our last like 5 or 6, and then you can proceed to another video or listen to another pod. Okay, so many questions on medication. Effective medications. Obviously, we've talked about like 19 million different diagnoses. I also just like put us in a crunch for time, but how like medication.
Okay, for what?
For anything, like just for mental health conditions, like. Well, not anything, not like Tylenol and Advil, but if you have ADHD, a lot of people were asking about like Vyvanse. They were asking about like stimulant versus non-stimulant. I know at least for me, and when I've talked about medication with doctors, like for my ADHD, like I have a history with uppers. So they were like, no, we won't be doing any of those for you. So then so it's more of just like behavioral and like mindfulness, cognitive like strategies. At least like that's like what my story was, but just like, where does medication fit into like healing and dealing with mental health conditions?
So for ADHD, stimulants are the gold standard. Medications like Adderall, Ritalin, Vyvanse are really helpful, but not everyone can tolerate them. So there are non-stimulant medications like Strattera, like Clonidine.
Yeah, people were talking about that. Yes.
And there are new medications coming out that are non-stimulant. Not everyone can handle a stimulant because it may interfere with your sleep and it may cause you not want to eat. So you have to have non-stimulant alternatives.
Yes.
For depression, antidepressants, but there's so many different types of antidepressants. There's SSRIs, SNRIs, there's non-SSRI type of medications. And so you want to talk to your doctor about all of those newer medications as well. Treatment-resistant depression, there are things like ketamine and newer research in psilocybin, like what I do at my lab. So there are tons of options. And there are things like ECT, deep brain stimulation, TMS. So these are devices that may help. With anxiety, we tend to try to stay away from things like benzodiazepines, but sometimes people need them temporarily, but SSRIs may be helpful. And then with things like schizophrenia, there are antipsychotic medications, but there are newer medications that have recently come out that are not antipsychotic that are beneficial in schizophrenia. With bipolar, mood stabilizers are very helpful. And so you want to talk to your doctor about it because there's so many and you want to know and understand the risk versus benefits versus alternatives. But you also want to think about your nutrition. A lot of times we are deficient in vitamin D, B12, and all of those are really important for your brain. So make sure you're eating foods that are healthy, that build up your brain. But some people will need vitamin supplementation.
So it's like not a one size fits all. I hear that's and then another thing this is just quick add on. So you know how like in those some like medicine commercials, they'll be like if you have like sudden thoughts of suicide or like sudden. So I have someone in my life who like did ultimately like that happened to them. If you're someone who's been on a medication and you are experiencing like out of the blue, sudden, like dark thoughts, like suicidal ideation, is there like a play? Like, is it like 911? Is it like talk to your doctor immediately? Like, what do you do if you're having like an adverse reaction? Well,
usually your doctor will warn you about that because there's a black box warning for antidepressants. It may increase suicidal thinking, but there's 988, which is the suicide text line. Usually that's the way to go before, going to the ER. But if you don't have access to a phone, that there's nothing wrong with the ER. But definitely always notify your healthcare professional, when you're having those thoughts.
And then definitely don't ever stop taking meds on your own, or stop doing things on your own is really important.
Yeah. Or really talk to your doctor about what happens if this happens. What should I do? Because let's say you're on a weekend and you can't reach them. You want to know what to do.
Okay, that's so important. Okay, that's great. So I feel like we got any big tools for just overall well-being that we haven't talked about when it comes to mental health?
Yes. So connection is really important. Make sure that you're talking with people. It's hard to feel happy and joyful when you're isolated. And a lot of the new research shows that loneliness and not having strong social connections is almost as bad as smoking a pack of cigarettes, right, a day. So you want to be able to pour into healthy relationships and foster those.
And if you're feeling really isolated and you're not making new connections, it's sometimes not to quote a televangelist, but Joyce Meyer, honey, sometimes you can't trust your feelings and you just got to get yourself out there and meet some people. You will feel better when you find some people that you resonate with.
Yes.
You really, really will. Rapid fire, we're almost there. Mental health in workspaces. If you've had a diagnosis and it's affecting you in your work, but you don't feel like it's a safe space to talk about it, how can you bring up your mental health stuff or your mental health conditions at work safely? Well,
you definitely want to know about your workplace policy for mental health. Not all workplaces are equal and some are not as friendly. So know what your policy is, know what resources there are. Many times when I go into these corporations, the employees don't even know that they have benefits. They don't even know that they have the ability to see a therapist or a coach. And, it may be helpful to find one or two allies in the workplace. When you realize that you're not the only one going through something and you have a friend at work to talk to, that makes you feel better. You don't feel as much shame and blame.
Dr. Judith Joseph, your work is so incredible. I'm blown away to share space with you. I've loved every moment of this. And I just can't wait to keep getting to know you in the future. I hope you get to come back. Or if you please come back.
I would love to come back. You're such a beautiful person. So thank you for having me.
Your book, High Functioning, it's out now. Get it wherever you get your books, but support independent bookstores if you can. We love you guys so much. And thanks so much for coming on Getting Better.
Oh, thank you.